Hi, my name's Olivia. I'm also known as Olivia K on Facebook. I am known as Ollie K on Instagram and Warm EM 9800 on Reddit. And normally I'm on those platforms to help people with nursing school and people who are about to take the NCLEX, whether it's RN and PN. I will leave the links below on where to contact me if you ever need help with nursing related material. So I want to talk about NGN style questions. I noticed there are a few people who are not doing good because they lack on how to answer NGN style questions. And I'll tell you, I had a hard time with NGN style questions at first too for a long time. When I first took the PN back in 2016, those kind of questions did not exist. So I was used to getting your traditional standalone questions where you get a question and then you get your 4 choices. And you get your select all that applies. And whenever you did to select all that applies, you didn't get the maximum points. And then the beautiful thing with NGN style, like you may lose some points wherever you don't get, but then everything adds up to the end. So that's the beauty of NGN style. And at the end of this video, maybe you'll eventually fall in love with it or you'll get to practice it more. NCLEX Crusade is the best person that goes over NGN style, and I'll leave a link below. So NGN style comes in different forms. So you have your case studies, and then you have my favorite, bow tie, actually. Believe it or not, I love bow tie. It's the best. I love bow tie so much. I really do. Don't even get me started. Then you have your drag and drop. Then you have the charts where like there's a chart, and then you have 2 different diagnoses where you have to compare and contrast the symptoms. So you have to kind of figure out which goes with what. And it takes practice which is why I've said in the past, and I will keep saying over and over, content very much matters, especially if you're doing NGN style, because you need to tie in content with whatever is being presented in the questions. Then select all that applies. And this time, when you're doing select all that applies, it counts. So you treat those, of course, like before, you treat them as true or false. So the best way I can tell you how to do NGN style questions is you need to determine the kind of patient you have, because sometimes they don't always tell you the age, and when they don't tell you the age and they tell you there's a patient coming in, you have to then assume that's an adult. Sometimes they're kind of specific. They'll tell you that you have a woman who's 24 or maybe 30, and then they mention gravida, para, that's your OB patient. So you need to pay attention to the kind of patient you have. Then you want to pay attention to relevant information pertaining to that patient. What are the problems being said? What are the problems being stated with this patient at this moment of time? So what I would do is you have to have a paper, and you need to write down the information that's relevant or highlight it. Or actually, what I always tell people is pretend that you're visualizing the patient and they're having these symptoms, and that you're the nurse in that scenario, so that's your assessment. And then it's asking you to recognize cues and develop what's called hypotheses. So that way you're able to answer these questions and see what they're looking for. Because with NGN styles, they expect you to use the nursing process. They expect you to be able to generate solutions and evaluate cues. So with bow tie, the same thing. It's going to give you the patient, the potential problems they're having, and then it's up to you to figure out what this patient may be dealing with at the present moment in time. And not just that, what will you do with that potential problem this patient's having? What is something you should look out for? What you monitor? What are the interventions for this patient? So that's usually how I would tackle those. With select all applies, you want to pick out the ones that you know are correct. And before you even do that, cross out the ones that you know is not true to that question that's being asked, because that gives you an idea of where to go and how to start. So if it's saying, if it's asking you about a person that has, let's say that they have their post-op with a broken leg, or they're in a cast. So they may ask you what intervention, what should a nurse look out for. And if one of them will say, I don't know, put a comb right inside the cast, that's wrong. That's completely wrong. So you would not choose that at all. So no, you would look for blow drying it in a cool setting, so that way the itching isn't present or something like that, or lessens the itching. Or you're going to check the CSM, so circulation, sensation, motion, in movement rather. So that's if you see that in the select all applies, or that's a knowledge you should already have. So I hope that helps. I will leave the link to NCLEX Crusade, because he is very excellent in explaining NGN style questions, and he does a whole 7-day thing. So you don't have to watch all 7 days, but he made me fall in love with doing NGN styles, especially case studies. It just takes practice, and if you have a good Q bank, select NGN style questions and use it for practice, not just to evaluate how good you're going to be when you take the test, but how to answer them, because that way when you're sitting on an exam, you know exactly how to answer the questions. I hope that honestly helped you, and you have a wonderful day.